Well, this is my first one on Zoom or online or whatever. So a little awkward, and I'm hoping my cats don't start crawling all over me.
They just want to join the party, that's all.
I want to know what world you live in where this is your first Zoom experience, because my life's been nothing but Zoom since the middle of March.
No, I've been doing Zoom. I just haven't presented on Zoom. So yeah, thank goodness. No, I've been on quite a bit lately, especially. So
yeah, I'm waiting not to be at some point.
I'm working on my doctorate in social work, and so my research, I'm at the point where I'm getting ready to do the research. It's going to have to be online focus groups, and so that'll be interesting.
Where are you getting your doctorate from?
Capella University.
Mm-hmm. Cool. Good work.
I hope to be done by the end of the year. So.
Okay, I think we can probably start when you're ready, Cueva.
Go ahead and share my screen. There we go.
Well,
No?
let
Oh, I'm sorry.
Let Cueva introduce you all, and then we can go.
Okay. Can you all hear me?
Yes.
Okay. Good morning. Welcome to the New Mexico Family Advocacy Program 5th 2020 ECHO presentation. NMFAP is a model of respondent parent representation being implemented in the 13th and 2nd judicial districts that utilize interdisciplinary teams of lawyers, social workers, and parent mentors working effectively together to provide quality representation and the advocacy and support families need for reunification or other preferred outcomes in the child welfare system. As participants in our community of practice, you will receive professional development from experts and early adopters of the NMFAP model. Learn best practices and collaborate to solve issues that present challenges to providing quality parent representation in the court system. Could the leads of the NMFAP please introduce yourself?
Hi, this is Leslie Jones. I'm one of the lead attorneys.
Catherine Brock, I'm a lead social worker with the program.
Hi, Camille Hancock, one of the lead social workers.
Hi, I'm Caitlin DiFiore. I'm also one of the lead social workers.
Hi, my name's Louise Archbeck, and I am a social worker.
So I'm Cueva Hubbard, parent mentor coordinator. I'm also a lead as well. We also have Jen, who is doing tech support. Would you like to give instructions for tech, Jen?
Yes, just for anybody, if you decide to join by phone, just a reminder to press *6 to mute and unmute yourself.
Awesome. Okay, so the announcements for today is please remember to complete your post-session feedback and reflection form found here. Jen will post that in the chat. Funding for our professional learning through NMFAP ECHO comes from a federal grant, so these surveys are very important to the program's broader evaluation and continued funding. Today's workshop is Commercial Sexual Exploitation of Children, Application to Child Welfare. I would like to introduce Elizabeth J. Hamilton. She's a LCSW, is the Deputy Director of CYFD Behavioral Health Services. Elizabeth has been deputy for the past 3 years of the community behavioral health, clinicians and behavioral health therapists embedded in CYFD's behavioral health services, who provide clinical guidance for juvenile justice and protective service involved youth. Also presenting with Elizabeth will be Diane P. Trujillo. She's a LISW, also a LCSW. She is a behavioral health therapist working for CYFD, Behavioral Health Services at the Albuquerque Girls Reintegration Center, AGRC. She has 25 years experience in mental health and behavior in various settings and populations. She has 20 years as a licensed master's level social worker. She has been independently licensed for 12 years and is a social work doctoral candidate at Capella University. Our learning objectives today are listed as 1, the definition of commercial sexual exploitation of children. 2, the types of commercial sexual exploitation of children. 3, the reframing of CSEC language and its importance. 4, trauma as it relates to CSEC. And 5, signs, tools to identify CSEC victims and perpetrators. And Diane or Elizabeth, would you like to start from there?
Sure.
Thank you.
So Diana's gonna go ahead and share her screen so you guys can all see the PowerPoint. And then from there, we'll get going because I know we have some time crunch going on.
Sorry.
That's okay.
Normal.
The joys of Zoom and online training. It's always fun. Okay. So welcome everybody. Good afternoon. So at this point in time, we're going to do a quick 1 hour around commercial sexual exploitation of children, or as we'll call it for short, is CSEC. So we're going to talk a little bit about some of the signs. Some of the objectives were just read out, and we'll go over that. So we're going to go over the definition of commercial sexual exploitation of children, which again would be CSEC. We'll talk a little bit about what types of CSEC there is, what we're seeing. We're going to do a quick little exercise around reframing the language. We're going to talk about trauma, how it relates to CSEC, and also the child welfare system. And then we're going to talk a little bit about trauma engagement. How do we engage with survivors of CSEC? And then we'll also talk about some signs and some tools that we're utilizing within CYFD. So as we're doing that, as we'll talk about that, I'll have Diana go ahead and start with giving you guys a little bit of an introduction to CSEC. First, if I can have all of you guys kind of look at your chat box and just type in one word that you think of when you think of commercial sexual exploitation of children. What pops into your head? If you guys can take the time while we talk a little bit about CSEC and start introducing you guys, if you guys can go ahead and type in the chat box, just one word that pops up. Any questions about that? I know everybody's in chat now signing in, so. We'll give you guys a second to do that.
This is Mary Ann D'Arcangelo. I had to call in because I've got to figure out how to get my Zoom to work, so I'm sorry about that.
Welcome.
Thank you.
So I'll have Diana go to the next slide and start talking about commercial sexual exploitation of children while you guys are signing in, and then when you guys have a chance, if you can start just throwing in a word, one word that comes to mind when you think of sexual exploitation of children.
Okay, thank you, Liz. So this slide, what we're looking at is we wanted to put a face to the CSEC, and we're starting with Centoya Brown Long, who's from Tennessee, and in 2004, she was viewed as a child prostitute and tried and convicted as an adult of first-degree murder of a man they referred to as a John, who was 43 years old, had picked her up for sex and took her to his home. In today's world, she would be viewed as a victim of CSEC, and the case that she's had is really multifaceted, but it's a good illustration also about how this progression happens of kids that are involved in sex trafficking, and also other broader systemic issues referred to as the sex abuse to prison pipeline and other issues in the community and the juvenile justice system. So I'm going to play just a short clip of a video here for you.
Family, who are they?
I just know Gina.
Gina? Is this your biological mother?
Yeah.
Gina, as in Gina and Gia?
Georgina Mitchell.
Okay.
But
how old is she, do you think?
She's probably 32.
Her biological mother side of the family is extremely heavily loaded with psychiatric disorders.
Bipolar, personality disorder, suicidal, manic depressive, which is an guarded condition. At times I've had homicidal thoughts for people that have hurt me. I've been raped, and I've always, wanted to do things to them for hurting me.
The night of August 6th of 2004. Where did you begin that evening around, say, 7 o'clock?
I was in the hotel room.
And what were you doing with Cut in the motel room at the In-Town Suites?
We were either getting high or having sex. That's all we ever did. He said that I was slipping and that I was starting to become a slouch, that I needed to get out and get on my grind and get some money.
What's this guy Cut? What's his real name?
Gary and McLean.
So how long were you living with him?
For like 3 weeks.
And then what was he like?
Different hotels. I remember one time, the first time he did something to me is when he choked me and I passed out. Because he said I thought he was a joke.
What else did he do to you?
He talked real bad to me and jacked me up. He pulled me by my hair and dragged me and stuff. He put guns up me, told me to strap and stuff like that, getting that after the beeper.
Did you ever have sex with the guys?
When I cut but a gun up to me, I did.
Did he have sex with you too?
Yeah, he had sex with me. Sometimes I don't want to have sex with him. He'd still me. I'd be crying and everything.
So how come you stayed with him?
You're not listening. I'm making him money. He wasn't gonna let me go nowhere. He's told me he'd kill me. He knows where my mom lives. And I know that dude choked me.
Okay, so on this slide, we're going to get more into the definition and kind of refer to Centoya's case a little bit too as some examples of CSEC. So the framework that we're looking at with providing the definition for CSEC was introduced as a statute that, an act that was passed into federal statute by the U.S. Congress in 2000, which formalized the definition of what sexual exploitation of children includes. And as they're on there, it shows some of the description of the range of crimes and activities that are part of this, and emphasis on the exploitation factor, and that for children, they are not able to give consent. So under 18, there is no such thing as consent. Other documentaries I've seen talked about, well, the sexual tourism term that's on the slide here. I wasn't real clear of what that was, but it talks about being transporting kids to other locations for the intention of having sex, different locations. It also noted that Orlando, Florida is considered one of the sex trafficking capitals because people will drop their kids off thinking they're going to engage in some kind of pro-social activities, and they're exposed to risks in the community. Didn't really want to read all that for you. Let's see. Also, I guess the main point as well is that, the exchange of things is things for value that aren't necessarily money, and can include you know, housing, it can include food, a number of things, and of course, attention, things that kids are looking for to get involved in this. The next slide talks a little bit more about the different forms of CSEC, referring to the first one, peer-to-peer. So there can be friends that are recruiting others or telling them, you know, introducing them to people that are involved in sex trafficking, boyfriends, that type of thing. It can be family-based, where they're you know, in the family, they're being exploited in one form or another by people that are in their actual family. There's gang-controlled, non-pimp controlled survival sex, independent renegading. That's another term that I thought was a little curious, which really is just talking more about leaving, you know, their normal, their customary form of life and going to some other non-conventional way of living, where they're aligning with someone else. And then there's the pimps and traffickers.
So we're going to move a little bit more into kind of breaking down some of the four like main ways we see individuals being trafficked. So a lot of what we see, of course, through CYFD and the child welfare system is the familial trafficking. And that is in regards to the use or exchange of some sort of sexual exchange for either money, some kind of goods, some kind of services. And it's by a legal caregiver or a parent. And of course, the person has to be under the age of 18. I think what's really hard about familial trafficking is that those individuals, those children being trafficked, they are with their most trusted adult, right? Which is mom, dad, aunt, uncle, somebody who is supposed to be taking care of them and meeting their basic needs. What's also hard about familial trafficking is that because it's within the family system, it tends to be a very close family, and children aren't always necessarily aware that this is something that is not normal. So they're not necessarily aware that, you know, dad's not supposed to be taking me to the hotel, meeting with some random guy. And so that's what makes it hard to get disclosures or for a child to also express what's happening. It's also a very closed system, so sometimes the kids end up disappearing from school or not necessarily going to school, so there's not people checking in on them. So familial trafficking is something I think that has also been on the news. There's trying to be more awareness around that. And then we move in after familial trafficking, we start talking about survival sex. Survival sex is something that we really see with our older youth, so 14 and up, and within our LGBTQ community. Due to the homelessness, lack of parental support with our LGBTQ community, they're at high risk for sex trafficking or even labor trafficking. And so survival sex includes, there's no third party, there's no pimp, there's nobody brokering the exchanges. These individuals who engage, they're looking for money, a place to stay, some sort of housing, maybe some clothing, maybe some food. And there's an exchange for some sort of a tangible thing to make sure that, so that those individuals are trying to get their basic needs met. So that's what we really see with survival sex. It's just that like they are just not capable of fending for themselves, and so they engage in sexual acts to get their needs met. And then Diana had talked a little bit about the gang trafficking. Of course, we see this on different levels. The main focus is making money for the gang and for their activities. It could be in conjunction with drug selling or selling of other items. It can also be seen at large venues or international venues, such as like Super Bowls or balloon fiestas or some of those really large things. Sorry, there's helicopters. I apologize if that interrupts. Something must be going on in my neighborhood. So that's gang trafficking. And then, of course, we hear a lot about pimp trafficking. That's when there's A third party who's engaged in the brokering or exchanges of sexual acts. On the video that you saw earlier, Centoya Brown talked about Cutthroat, who was her pimp, who was engaging in setting her up with all the different people. They are the ones that technically take the money. They're not a legal caregiver. I think that's something that we also need to remember. If it's a legal caregiver, it's considered familial trafficking. If it's not a legal caregiver, it's considered pimp trafficking or somebody who's brokering the exchanges. And again, there's always some sort of monetary gain from it. So right now I kind of want to move into how do we reframe our language around child sex trafficking. I had asked you guys earlier to throw out in the chat some just different words that come up. Some of you guys put out blame, not talked about, pornography. If you guys have the chance to throw out any more, because I know there's a lot in the chat going on. Trauma, vulnerable, historical trauma, drugs. What kind of language do you think people who aren't trained to work with children would throw out there? If you guys want to put out some of what you would hear on the streets. Like, what would you hear on the streets if you were talking to a random person that didn't work in the child welfare system? What kind of words do you hear? Dramatic, groomed, loose, right? Child prostitute. I know in some areas they still use that, hoe, right? So it's pretty derogatory, right? Some of the words that we hear when we're talking to people that have no clue about this stuff, little slut, it's all pretty shameful, right? So think about this when we're talking to a child or a youth and we start to use inappropriate language. And we're looking at them as being a teen child or child prostitute. What does that language do? It places a lot of blame on the child rather than recognizing that they're a victim or they've been perpetrated on. A lot of the times they start to feel like they're bad kids, or it places some sort of label on them, saying that they're a bad kid, such as a slut or a hoe. And it's a long-lasting stigma that happens with them. Yeah, they come from a bad home. Where are their parents? How could that be? Like it's their choice. It also puts it as if it's their choice. You know, why don't you leave? How could you do that? What would make you do that? So when we're using the inappropriate language piece, it's really victim blaming that we see. So part of this is we also have to think of them in more of appropriate language and really see our kids and our youth as being victims or survivors of something tragic and terrible that's happened to them, right? Because if we're able to change our language, we're able to see that it recognizes the child as a child. We also recognize that sometimes developmentally, legally, or socially, they're not capable of making those choices. As in the definition of sex trafficking, there's always that force, fraud, or coercion that occurs. So these kiddos are put in a place where they just don't have a choice and they're being made to do different things, right? So we want to be able to label to make sure that they understand it's not their fault in any way, shape, or form. We want to make sure that we're using language that's supportive and empathetic, and recognize the things that they've gone through. So they've been coerced, they've been manipulated, they've been controlled violently, they've been threatened. So we want to recognize that that's very traumatic. And so when we're talking to them, we want to make sure that we're not calling them names such as an offender or a perpetrator. It's really good to use their name and ask them what they'd like to be called, and see them as a human. And so that's part of what we really would like to do when we're looking at appropriate language.
In this next section, we're just going to talk briefly about some examples of what Liz was referring to, some of the signs and tools that are used to identify the CSEC victims and perpetrators. So she had referred to use of force, you know, including sexual abuse, battering, rape, drugging, confinement, forced abortions, kidnapping, torture, starvation, fraud, promises of valid immigration documents or job offers that or easy situations, I guess, promises of money or salary, misrepresentation of work conditions, wooing into a romantic relationship. The fraud part, I've heard it referred to as finesse, the finesse pimps, who are conveying the message that they care for the person or they love them and they're going to take care of them. And then it turns into the coercion piece of it, where they're threatened with harm to themselves or their family. Centoya was referring to Cut knowing where her mom lives and he could kill her. Centoya at any time wouldn't think anything of it, and so she felt the threat was real to her mom, her family. Threats of deportation, threats of physical abuse, withholding of drugs. So the drug tactic, when they're getting them hooked on drugs and using that as a way to keep them part of that. Verbal abuse, again, that's using the language, first building them up with things like telling them they're beautiful and they love them and they're special, and then it shifts into other things like you're worthless, you need to go do something for me, you owe me, that type of thing. So next, a little bit more about the risk factors and characteristics of CSEC victims and things to look for. So again, looking at the risk factors, you've got these various categories and they're not mutually exclusive. So, they might be part of each of these categories. Again, the history of trauma and abuse, which Centoya talked about and her mom talked about, who had a long history herself of abuse and witnessing domestic violence and violence in her own family, witnessing suicide by shooting, that type of thing, and then being forced into what she called prostitution when she was underage as well. Might see the involvement with juvenile justice or protective services, foster care placement, some of Centoya's history. She was adopted by a two-parent family when she was 18 months, but in this whole process, she also had 6 foster care placements. And so there was a lot of instability, and she developed some attachment and abandonment issues. The being in group homes or shelters, same situations, homeless, runaway, unaccompanied youth, LGBTQ youth, and those ones you see kind of clustered together. What I wanted to emphasize here is that, a lot of times you'll see people of color or marginalized populations as examples of this, but CSEC is crossing, gender, socioeconomic status, race, ethnicity. So, when we're using the videos and the 2 that we selected, it's not like trying to state that this is just these individuals in particular, this category of people. And let's see, the developmental poverty, again, another thing that's maybe assumed that they're poor. There is cases that are discussed when we get to the second video. If you watch it in its entirety, they do discuss about a female Caucasian university student who's from a well-to-do family, who's also a victim of sex trafficking. Then, of course, developmental delays, mental and behavioral health issues. Those are other factors. So this slide talking about looking, the signs to look out for. Some of them, I think, are pretty well understood, that they're trading sex for a place to sleep, or a pimp prostituting out a youth. And I did want to mention too about the language, you know, also appropriate language when we refer to the people that are perpetrating them, you know, by calling them pimps or tricks or daddy or whatever, that kind of also reinforces the notion of choice and consent. And, you know, when those people probably should be referred to more accurately as child rapists or sex offenders, you know, I think makes it a little bit more true to what's going on there. Parents trading underage kids for drugs. We had a case like that in Albuquerque not that long ago. Landlords, you know, having sex, you know, taking in lieu of the rent, they're going to take sex. Business owners providing shelter and food. And so you'll hear cases where there are questions that can be asked of CSEC victims that can kind of give you, shed more light on things that are happening if you ask them, you know, are you living with your boss? Do you owe them anything? Do you feel free to leave? Stuff like that. We'll put it more into context and help you get a little bit clearer information. The next one, we're talking about the red flags, so things to look for again. When you're interviewing kids, no matter what the setting, you know, they might be talking about, you know they're not working, or they're too young to have a job, or that type of thing, and yet they're in possession of cell phones or multiple cell phones, or they're constantly changing phone numbers, or they have certain possessions that you're not really understanding how they get these.
I was a firefighter for 25 years. I couldn't.
There's also, they may have had multiple sexual partners at a young age, frequent stays in hotels, motels, even if they live nearby. Centoya talked about, you know, living at various motels with cut and in areas that were, until they ran out of money, and then he started pressuring her to get out there and contribute. They may be wearing clothing that is, you know, not appropriate for the season. So maybe it's cold out and they're wearing scantily clad or whatever. Again, the terminology they might be using, the life, referring to someone as daddy or tricks, that type of thing. And then they may have physical or behavioral signs of physical, emotional abuse and or neglect. So some of these victims that I've seen, you know, describe themselves as being, you know, washed up, or they've used, and they may have bruises, that type of thing. Sometimes they have tattoos. They may have tattoos of the same person, and that can be viewed as branding, you know, pimp branding them. Moving to the next slide. So here we're talking, here's the tattooing and branding, and you know, kids that are leaving home without permission or running away for periods of time, relationships with people that are significantly older or met online. So Centoya referred to being 16 and having a 24-year-old boyfriend, and I think we hear that quite a bit. Kids that want to hang on to their phones so they can be on social media, so they have connection to people. Again, the expensive or unexplained possessions, or they're with somebody that doesn't let them be alone or restricts their movement. Multiple abortions or miscarriages as well. So in this slide, looking at kind of generalized statistics, that the CSEC victims are twice as likely to have experienced out-of-home care, 5 times as likely to have been in group homes, 10 times as likely to have a report, a missing child report on them, more likely to have prior allegations of maltreatment, so that would be their protective service involvement, more likely to have had multiple allegations as well, or even referrals to juvenile justice. So on the next,
So we'll look a little bit now on like who the traffickers tend to be. So of course, a trafficker can be anybody. It's anybody who can benefit from the commercial sexual exploitation of a minor or facilitate some sort of exploitation of a minor. It could be their pimp, it could be their boyfriend. You know, sometimes their boyfriend's like, hey, hook up with so-and-so because he owes me, you know, I owe him some money. Why don't you go ahead and hook up with him? It could be the father, the mother, it could be the coach, teacher, it could be a friend. So I think that's something that we also need to remember is that the person who is the perpetrator can be anybody, any ethnicity, race, domestic, foreign, family, socioeconomic status. I mean, you see, I don't know if anybody's watched the Netflix documentary on Epstein and kind of what was going on in that world and how really disgusting it is. I haven't watched it because I just can't bring myself to do it. And so some of the characteristics that we look for are, you know, traffickers are smart. They look for some of the most vulnerable individuals. They're looking at those kids in foster care. They send other kiddos to school who then engage and befriend those kiddos that could be in foster care. Those kids that are homeless seem to have low self-esteem, kind of express, you know, that they want to be loved. So they're sending somebody in, or they themselves are going in and they're exploiting the most vulnerable piece of that individual youth or child. It could be another peer who's recruiting them, same age, little older, or even younger. It could be, it really can be anybody that can bring them in. They can be engaged in activities at school. They could be in an after school activity. It could be their fellow cheerleader who is, you know, making money on this side that's pulling them into something. I think we also need to remember that children involved with the child welfare or juvenile justice services are also already marginalized children. And so they're an easy target for the circumstances of trafficking because it's also trying to find those kids that want to fit in and belong somewhere in exploiting that piece. And so just going over the process of pimp control real quick. Of course, recruitment consists of the luring of the individual with love, affection, money, safety, a sense of family. It may occur in person. It could be online via social media. It could be, you know, through TikTok videos. It could be through, what is the game that everybody's playing, the kids? It could be through video games. Sometimes it's handled by the actual pimp, or they could have a bottom girl or somebody else that they send in to recruit these individuals. The grooming process occurs using, of course, like increased isolation, control, breaking them down, threatening them. All of those force, fraud, and coercion pieces all take place during that grooming piece. And then they get to a place of turning them out, which is when they feel like they're in a place of, when they're in the place of I never have phone calls except for now. They're turning them out when they start getting them into making money for them, setting up appointments either online, on the streets, pulling people in from the hotels. That's the piece of turning them out and starting to get into the exploitation part. So Diana is going to dig a little more into some of the trauma now.
So this slide is asking the question, I think, that we hear a lot in various settings. Trauma victims, whether they're domestic violence or sex trafficking, why are they staying? Why are they don't just leave their situation? So some of the factors that are involved with that is keeping them isolated or limiting their activities, preventing them from seeking help. Some of it's that grooming process too of you know, the gentle behaviors and loving, and then turning into the more coercive behaviors. So this also talks about coaching or grooming, telling them how to answer certain questions, that type of thing, and also then preventing them from seeking help. So because they're in fear of threats to themselves or violence to their family members. Again, in general, having fear and distrust of health providers, feds, police, CYFD, immigration, being deported, also their own perceptions of themselves, not viewing themselves as a victim, belief that maybe they had a choice in this, and since they chose to do this, that they're in control. And then of course developing loyalties or positive feelings toward their perpetrator, as ways to cope, and just the overall programming that they go through. Moving into the trauma piece of it, so we're going to talk a little bit about trauma in general, which is referring to events or experiences that are in the social system that have a significant negative impact on the individual. So trauma can be a car accident could be considered trauma, or being in a hospital, surgery, or that type of thing, all the way to different types of abuse or witnessing scary or troubling events. This slide is showing the continuum of trauma, going from the less complex or single event trauma to more complex. So the on the less complex end, you're looking at maybe an acute incident, one incident of trauma, then towards the middle, maybe chronic trauma, repeated or prolonged domestic violence or abuse. And then on the more complex end, we're looking at being exposed to varied types and multiple traumatic events. And frequently they're invasive and of an interpersonal nature. Trauma bonds, a lot of times we've heard it referred to as Stockholm syndrome, where and this refers to the relationship between the victim and the perpetrator. So first, you know, being subjected to threats of physical or psychological violence, and a belief that it's going to be carried out, and then mixed in with those small acts of kindness, you know, that are first poured on, you know, in the early stages, and then switched to coercion, physical and perceived isolation by the abuser, and also perceived or actual inability to escape. This is talking about signs of trauma bonding, so things you would look for. And depending on when you're encountering the victim, they may be in more of a stage of, you know, denying or rationalizing the violence or the injury, you know, being grateful to the abuser for some kindness, and then believing that the perpetrator has control over them, or that they have their own control as well. You know, that by cooperating, then I have control of not being subjected to more violence or being forced to have sex, that type of thing. And then to the stage of blaming themselves for the situation and their abuse. So again, you know, talking about trauma bonds and how they're formed, same thing that we've been talking about, you know, the alternating acts of violence, excuse me, violence and kindness. Belief then, you know, in the programming, they're now believing that any thoughts that they have, their perpetrator is going to be aware of them and they will retaliate. You know, again, more isolation is reinforcing this. Shame and stigma, so associated with prostitution. So once again, the effects of language that's being used, reinforces that, or if the individual lost their virginity to their perpetrator, then there's more of a bond that might happen. Some have talked about where they're viewing their perpetrator as a romantic partner, that, you know, this person loves me so much, they want me to have a baby, and the baby would be the hook. So if they do get pregnant, then they feel more bonded to the perpetrator and continue the cycle. And again, victims of trauma are more vulnerable to the link between love and violence. So some ways to recognize this is going on. Bonding is the positive feelings towards the abuser, negative feelings about their own family or others that might intervene, or even people trying to rescue or support them. And then also reinforcing the abuser's reasons for what's happening, and again, the positive feelings toward the abuser, and the inability to engage in behaviors that can assist their release. Some of the typical signs of trauma or symptoms, you'll see disturbed sleep or acting out, defiance, truancy, or risky behaviors. So a lot of times these kids might be referred to as troubled kids, throwaway kids. You know, they're just acting out, they're just being, you know, they're being difficult. Anger, irritability, withdrawal, isolation, repeated intrusive thoughts, and then experiencing distress when there's reminders of the trauma. And then substance use or numbing. One of the kids I worked with talked about, you know, the cutting that she had been doing was because she felt numb all the time and wanted to actually feel something. So then here is the next video that we wanted to show, a clip, put another face to a situation of a CSEC victim. This youth is from Florida, and again, she was around 14 when hers started.
A pit stop and then they go somewhere else. No. Our children here in the United States are being trafficked. Where does it start? How does it happen? Not how you think.
It all begins in the house. It really does.
Anique Whitmore is a forensic psychologist focused on understanding the minds of human traffickers and their victims.
They're running away from a home that they're not valued. They're experiencing some sort of trauma in that home that they are not content with. They want to escape. And so they show them a good life, maybe for 2 days, and then they're in.
Thirsty? Is that why you're doing that? You thirsty?
Sasha Ray was born and raised in Florida. By the time she was 14, she was constantly being teased at school.
What I got picked on a lot about was being black. Like really, really dark skin, I guess.
She felt alone, at home and at school. Sasha Ray says that's why, when an older classmate offered friendship, she jumped at it.
I thought she was like my best friend because I could like tell her anything. And one day she asked if, you know, I want to skip school, we're gonna have fun, you know. So we went to this barber shop. When I was there, she introduced me to these guys.
Sasha Ray's new friend had just led her to the man who would eventually become her trafficker.
They talked about how it was going to make money, how it was going to be easy, we didn't have to depend on nobody. And it was all sounding good and stuff, so I fell for it.
Was there any kind of grooming process, like when this first started, or it's just something that just happened and he was just expecting you to learn on the way?
He slowly brought it on when we got closer, when he felt like he got closer to me. He usually did it out of the back of the barber shop. And he even had people that work with the post office, mailman come in. Mailman came in and paid their money to him, came back there to me.
We're gonna keep moving forward here in the interest of time. Liz will take it from here on the entry points.
Okay, so in that video, as you guys heard, there's lots of different entry points. We kind of went over earlier. You know, friends, people coming in. So now we kind of want to look at like, how are some of the ways some of these girls get out, or how are some of the ways these girls are identified, or these young men, or these children. So some of the ways we can see entry points is through law enforcement. They're doing some sort of a prostitution sting over at the hotels or at a house, and they're caught in that. And so I know there's been a lot of training, especially here in New Mexico through the AG's office, trying to really do a lot of training with law enforcement to recognize and understand that these other underage girls are not prostitutes. They're actually victims of some severe trauma. And so to look at them in a different manner. Sometimes there can be some sort of a domestic violence call because of the abuse that's occurring. They're picked up for drug charges. They run away, homeless. There's some sort of assault charges, or something simple such as they were at a store and they were shoplifting makeup because they felt like they needed new makeup and their the trafficker wasn't getting them what they needed. So those are some points that we are able to identify these kids once they come into like the juvenile justice office, or if they're coming in and say like there's a domestic violence call or it's a prostitution sting, child welfare is coming in. And so we're really working on the training piece to really help with identifying those individuals better and recognizing them as being victims. So there could also be engagement with different providers, like from the medical field. So a lot of the girls or the boys will go in, get an STD test, maybe an abortion, or need some sort of medical care. And so I know there's a lot of work with medical, such as emergency rooms, urgent cares, those free clinics, to really start looking at identifying and doing some questioning when individuals come in, so we can see if we can identify if they're possible victims of trafficking as well. And then if they are at school, you know, if they're noticing something's different about an individual, they're able to call in social services or law enforcement and start asking some questions as well. So we're gonna move it on over to trauma-informed care, and Diana's gonna take it from here.
Can I say something real quick? Just for those of you who need to check out at 1, it is currently 12:55.
Thank you. So I don't want to go too fast, so I'm just going to give some points on this. Fortunately, a lot of you here are social workers and have some training in this area. When we're talking about trauma-informed care, just in general, it's a practice that promotes a culture of safety and empowerment and healing, guided by some principles that include safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and then attention to cultural, historical, and gender issues. So on this slide, you're seeing some of the activities to engage with someone in a trauma-informed environment. You know, being authentic, establishing the trust, you know, feelings of safety, and that can include the setting itself. Some medical settings can be viewed as traumatic, and so ways to make them feel safe. Other activities, you know, to be aware of is also that questions can be viewed as invasive and judgmental. And once again, here's the language. Use of the language can be really important. Some expectations you can have also, expecting the victim to return to the trafficker, and you know, so not being surprised and avoiding gestures that are displaying shock and blaming. And then to facilitate prevention, you know, again, more activities, importance of establishing the relationship, building rapport, allowing them to go at their pace and not forcing people to talk about their trauma, to relive it, and then understanding some supports that they might have in place. Sorry, I'm trying not to go too fast here. Just want to touch on a tool that was introduced, we've been getting some training on, called the See It tool. And it's a screening tool, not an assessment tool, that was developed by West Coast Children's Clinic. And it's designed to be used by various people, so they don't have to be licensed professionals, but can also be law enforcement and or providers and shelters and that type of thing, caseworkers. Of course, in California, it's, you know, some of this stuff has been implemented into a law, so they're having to use the screening tool. And they refer to it as a universal screening tool, so that's the talking about it being used in different settings and identifying those that might need further evaluation and intervention. This can be used by JPOs, protective service workers, and that. And there is a link there if you want to look at get a copy of the tool. It's really easy to use, and it's really an excellent tool. We have resources also identified on this next slide, which, you know, the 24-hour tip line, about children's hotline and cyber tip line. And then we also have the link there for missing kids, missing and exploited kids. Just trying to make sure in case we had any questions before our time is out. So hopefully we can have a little bit of discussion before we run out of time here. Are there questions, or did anyone want to share anything? On the slides itself, we didn't include our contact information, so it's included there in the chat, our email addresses.
Well, and thank you guys all for doing this. I know it was during your lunchtime, so really appreciate it. I think one of the biggest things we really just want you to take away is that anybody can be a victim of trafficking, no matter what kind of sorry, I was reading that. Our local PD is more receptive to taking reports on this than, you know, I couldn't tell you what the local police department is. I know the AG's office continues to have a statewide human trafficking committee that they engage in working on this, and local PD is there. So Albuquerque Police Department participates in that. The Bernalillo County Sheriff's Department participates on that, and then also, of course, the AG's office, and they also work with like the FBI and Homeland Security. And so they all work together in trying to really identify and work in collaboration to make sure when a youth is identified as being a trafficking victim, they're able to collaborate and make sure that those youth are getting services to support them. And protective services and juvenile probation also works in collaboration with the AG's office to report when we have any kind of suspicion. If we're looking at some of those red flags, we start asking more questions. We're in the process of training CYFD and the See It tool so we can start working on implementing those into our policies and procedures through JJS, through behavioral health services, and through protective services, that we have a better handle and a better grip on the potential of our kiddos involved with our system, and what they could possibly be, trafficking victims or involved with it. And then all of the videos, you can actually, Diana, if you want to, I don't know if you can cut and paste the videos that you utilized and put them in the chat box. If not, you can actually YouTube the CNN Jada Pinkett Smith, and that will come up. It's like it's a pretty long little story documentary. The nice thing is she kind of like goes over all of the different places that it could go and be engaged in, from different socioeconomic, from different ethnicities, all of that stuff.
Uh-oh. I was trying to cut and paste and got moved out of here, but it's in our reference section there. Centoya Brown has a book that came out recently called Free Centoya. Talks about her redemption from the American prison system. It's excellent. The audio book is narrated by her as well. And I don't know how to cut and paste.
Oh, I'll do it. I got it. Gotcha.
Sorry. Okay.
That's okay. I'll cut and paste those links to those different YouTubes.
Okay. Thank you.
And then anybody else have any questions? I know a lot of you guys have to go. It's after 1. I just want to thank you again. I know it's during your guys' lunch hour. And I hope some of it was new information and helpful to all of you guys.
Hopefully I wasn't too rushed. Those last slides went pretty quick. So I was trying to get it done before 1. Thank you very much.
The YouTube links are in the chat.
Thank you, Elizabeth. Thank you, Diana.
And it was good seeing some of you guys that I do know. I recognize some faces. Miss Susan Burns, Camille
Liz,
Hancock.
I thought you looked familiar to me and I was trying to pull it in. I guess you're one of my students too.
Yep, NMSU and La Familia.
Oh yeah, it's because when I saw Elizabeth, I didn't think of the Liz. So anyway, well, nice to see you. This was wonderful. Thank you.
Thank you all. You guys all have a good day.
Thank you, Elizabeth. Thank you, Diana.
Thank you.
I was just going to ask a couple of the NMFAP leads if you could hang back just a bit.
Okay. So just for a wrap up, so could you all please remember to complete your post-session feedback and reflection form found. Jen is going to post it. Please take a moment to cut and paste this into your browser and take 5 minutes after you sign off to complete the form. The information you share helps our NMFAP team to provide more effective professional learning and support in the weeks and months ahead. Our next NMFAP ECHO didactic session will be July 21st, and the topic will be Understanding the Fostering Connections Act. We encourage our NMFAP practitioners to sign up to present as a case or issue at one of our upcoming problem-solving issue processing sessions. The case or issue does not have to be on the same topic as a session, but can be about any case or issue relevant to our practice for the practitioner who would like to get input from the group. Our session announcements contain links to the sign-up form and case presentation form. To submit a case or issue, please complete and send the form to our coordinator, Jen, at echonmfap@gmail.com. And thank you all for joining us today.
Thank you.
Thank you again.
Thank you, Liz.
Hey,
Bye.
Jen.
Thank you, Diana. Really appreciate it.
Thank you.
There's some questions about if we can keep their emails and let them know when the next ECHO sessions are.
Bye-bye.
So add those people to the list.
I'm saving the chat and I will go through it and enter those folks. Okay. So I was just going to let you guys know that tomorrow I'm probably not going to be available, and tomorrow is the CYFD meetings. In the morning, I think, is Bernalillo, and in the afternoon is the 13th. So I was going to ask one of you if you could start the Zoom and if you could take care of those sessions. I would really appreciate it.
Yeah, I can do it.
Thank you.
Were you going to do both sessions, Caitlin?
Yeah, I can.
Okay.
Oh, good.
I'll be your backup if you need help. I got support.
Okay.
Cool. All right, that's all I had to ask you.
You guys aren't saving anything from those sessions, right? Though it's just.
Only if something comes up that that you guys need us, like me, to follow up with, like, I don't know, sending them something or sharing a folder or anything like that. You know, if something just comes up that you need us to do follow up or something.
Okay.
Or if something important, like if they announce something important that might impact the program, then obviously just let everybody know or whatever. The usual stuff. Yeah.
Of course. Okay.
That's it. Thank you very much. I appreciate it.
Thank you.
I'm glad you're taking your time off, Jen.
I'm not.
You should be.
I know, but I can't. I mean, you just saw the feds. I was like, shit.
No, you can. You just tell them I'm on vacation right now and I will get to it when I'm back in the office.
I know, but it's not really a vacation either, you know. I'm working. Either way, I'm working. So no, but I got out the social work contracts, but still working on, like, you know, Lindsay has to give me more feedback on the attorney contracts before I send those out. And then all of you leads, I pretty much same thing. Like, I have to let Lindsay look at it before I just send it to you, just in case there's anything that I'm missing or whatever. So, but yeah, when you guys do get your contracts, if you guys see anything that you want to talk to us about, please let me know, because again, I was pretty much flying. I was going based on like the practice guide, like sort of trying to throw some elements from the practice guide in there. But they're pretty much the same, you know, it's like the same stuff that you guys have been doing. It's just a little more formalized in the language. So there shouldn't be anything new or surprising necessarily. Disclaimer.
Disclaimer, yeah, really.
Yeah.
Okay.
If there's anything we can help you with, Jen, let us know.
Man, if you could write those contracts for me. Write your own contracts. No.
Really? Yeah.
You can write
It
in
may
the
come back with a different amount, but all right.
Right? Yeah. Believe me, it's not for lack of wanting to give you guys more. It's just other constraints, of course, as usual.
Are you driving back in your move?
Oh my gosh.
Yeah. Twice. I got to do this move twice.
Why?
Because there's so much. And so like I think we start driving back Saturday, and then it'll obviously take us a couple of days, and then I'm back in New Mexico for like a week, and then I fly back again, and then we drive.
Wow. That sounds crazy, Jen.
I know.
Be careful.
Thanks. Yeah.
Yeah.
And they have to watch out for me. All right. Well, anyway, any support you guys can give me, I'll appreciate it. And if I might just be emailing like, hey, can you help me with this or whatever, just like I did now.
Yeah.
Appreciate it. Caitlin, you don't have to worry about this for much longer, but I might have to utilize you up to the end.
That's fine.
All right.
Don't be afraid to ask.
Yeah.
Thank you.
Okay.
Okay.
Okay. Bye.
Bye. Take care, guys.